Unfortunately, the prevalence of diabetes in our society is increasing significantly. It's a terrible disease, and the three areas of the body that get affected the most are the eyes, the feet, and the kidneys because they have the smallest blood vessels. So every diabetic, whether they take the pill or they take insulin, should see a podiatrist on a regular basis, sometimes some annually. Every diabetic should at least go annually for an exam. And other ones, for example, Medicare will allow diabetics, most diabetics, to come in every 2 months for care of their nails and calluses. They should not be cutting their own if they're at risk, and most diabetics are. And that's why Medicare also allows once a year, in most cases for diabetics, nice shoes. Some look like sneakers. They're not what's quoted old lady shoes with insoles that keep them safe. So generally, the key things with diabetics are, number one, check your feet twice a day. That's critical. And what you're looking for is anything that looks unusual. Cuts, redness, anything. If you see it, call your podiatrist, call a podiatrist right away. Do not do what's called bathroom surgery. Do not put ointment on it. Don't put Band-Aids on it. Just call them right away and get in. We call that a medical emergency. You know, we always say if the fire is small, it's very easy to put out. But if the larger the fire, the harder it's to put out. So the idea is that's one very critical thing. The other thing you want to do is never go barefoot. Barefoot, some people say, but I wear flip-flops or I wear a slipper. But are you wearing a slipper that has a hard bottom to it? You want to protect it. We always say it's like a motorcycle. You want to wear a hard helmet. So even if you get up to go to the bathroom at night, wear a good slipper that's closed with a good thick bottom. We've had a number of patients come in who said, I was only going to the bathroom and they kicked their toe, you get a little crack, it's not healing. So, you know, the other real thing that we see are patients who say, well, I only take a pill, I don't have bad diabetes. It's like being pregnant. Either you're pregnant or you're not. So the idea is it's a simple visit to your podiatrist or to our office, and we're very qualified. I personally trained at UCLA in a diabetic foot clinic there. Dr. DeWaters, Dr. Adio, Dr. Goodrell, and Dr. Langley all are extremely well trained in diabetic care. It's one of our specialties. We also very effectively treat ulcers of diabetics. We always feel we're much more comprehensive than wound care clinics because you're seeing the same doctor every time. We minimize the amount of tests that you need. Again, we have digital x-ray. We have all wound care products right in our office. So again, that's the focus, and diabetics have to take care of their feet.